The emergency room was chaos. 3 ambulances had arrived within 10 minutes. A car accident on I-64 that had turned a Tuesday afternoon into a battlefield. Doctors and nurses scrambled between gurneys, shouting orders, fighting to save lives. In the middle of it all, a woman sat alone in a wheelchair, clutching her chest. Her name was Dorothy Williams. She was 58 years old, 240 pounds, and having a heart attack. She had told the triage nurse about the pain 20 minutes ago. The nurse had taken her vitals, frowned at the numbers, and said someone would be with her shortly. That was 20 minutes ago. Now Dorothy was turning grey. "Please," she whispered to a passing orderly. "I can't breathe. Something's wrong." The orderly glanced at her, then at the chaos around them. "Ma'am, we're dealing with critical patients. Someone will—" "I am a critical patient." Dorothy's voice cracked. "I'm having a heart attack. I know what this feels like. My husband died of one." The orderly hesitated. Then he flagged down a doctor, not just any doctor. Dr. Harrison Cole, chief of surgery at Tidewater Regional, was striding through the ER like he owned it. Because in many ways he did. 15 years at the hospital, published researcher, board member, the kind of surgeon other surgeons wanted to be. He was also, as Dorothy was about to discover, the kind of man who decided which lives were worth saving. "Dr. Cole," the orderly said, "this woman says she's having cardiac symptoms." Cole glanced at Dorothy. His eyes swept over her body, the extra weight, the sweat-stained blouse, the cheap shoes. His lip curled. "She's having a panic attack," he said without checking her vitals. "Give her a Xanax and send her home." "Doctor, her troponin levels were elevated." The nurse said, "I don't care what the nurse said." Cole was already walking away. "We have actual emergencies. I'm not wasting an OR on someone who can't put down a cheeseburger." He disappeared into the trauma bay. The orderly stood frozen, unsure what to do. And in a bed 15 feet away, a man who had been pretending to sleep opened his eyes. Lieutenant Commander Marcus Reed had been admitted that morning for observation. Shrapnel wound from a mission that didn't officially exist. He was supposed to be resting. Instead, he had just watched a doctor sentence a woman to death. Marcus pressed the call button. "Get me the hospital administrator," he said when the nurse arrived. "Now." "Sir, you're supposed to be—" "I don't care what I'm supposed to be." Marcus sat up, wincing at the pain in his side. "That woman is dying, and I'm not going to watch it happen." Dorothy Williams had spent 32 years teaching 3rd grade at Norfolk Elementary. She had weathered budget cuts, overcrowded classrooms, and a generation of standardized testing that tried to turn education into a factory. She had bought school supplies with her own money, stayed late to tutor struggling readers, and cried at every graduation because she remembered each child as the scared 6-year-old who had walked into her classroom years before. She had also buried a husband and a son. Her husband Frank had died of a heart attack 8 years ago, massive, sudden, in the middle of mowing the lawn. Dorothy had performed CPR until the ambulance arrived. It hadn't been enough. Her son Michael had died 3 years ago in Afghanistan. The details were classified, but she knew enough. He had been a Navy SEAL and he had died saving his teammates during an ambush in Helmand Province. They had given her a folded flag and a medal and told her that Michael was a hero. She had smiled and thanked them, and then gone home and screamed into a pillow until her voice gave out. Since then, Dorothy had gained weight. Grief will do that. So will loneliness and antidepressants, and the simple fact that cooking for one person feels pointless, so you order pizza instead. She wasn't proud of the weight, but she also wasn't ashamed of it. She was a 58-year-old woman who had survived more loss than most people could imagine. Her body had carried her through all of it, and now her body was failing, and a doctor had looked at her and decided she wasn't worth saving. Who is Marcus Reed? Lieutenant Commander Marcus Reed had been a Navy SEAL for 18 years. He had deployed to Iraq, Afghanistan, Syria, and a dozen other places that didn't appear in the news. He had been shot twice, stabbed once, and blown up more times than he could count. He had a Silver Star, a Bronze Star with valor, and a body that was held together by scar tissue and stubbornness. He was in the hospital because a piece of shrapnel had decided to migrate toward his liver, 2 weeks after a mission in Yemen. The doctors had removed it that morning and told him to rest. Marcus was bad at resting. He was also bad at watching injustice happen without doing something about it. The connection. Marcus had known Michael Williams. They had served together in Team 4 before Michael transferred to Team 6. Michael had been young, eager, the kind of operator who volunteered for every mission and never complained about anything. Michael had also been the one who dragged Marcus out of an ambush in Helmand province when Marcus took a round to the leg. Michael had carried him 400 meters under fire, applied a tourniquet, and called in the medevac. 2 hours later, Michael went back out with a different team. He didn't come back. Marcus had gone to the funeral. He had seen Dorothy from a distance, a heavy-set woman in black, standing straight-backed and dry-eyed while everyone around her wept. He had wanted to say something to her, but the words wouldn't come. What do you say to the mother of the man who saved your life? Now, 3 years later, Marcus was lying in a hospital bed watching that same woman die while a doctor cracked jokes about cheeseburgers. He couldn't save Michael, but he could save Michael's mother. The hospital administrator was a woman named Patricia Holloway, mid-50s, grey suit, the permanently exhausted expression of someone who spent her days managing egos and budgets. She arrived at Marcus's bedside, looking harried. "Lieutenant Commander Reed, I understand you had a concern." "That woman is having a heart attack." Marcus pointed at Dorothy, who was now slumped in her wheelchair, barely conscious. "Your chief surgeon refused to treat her." Patricia's face tightened. "I'm sure Dr. Cole made a clinical judgment based on her weight. I heard him. He said he wasn't going to waste an OR on someone who can't put down a cheeseburger. I'm sure that's not exactly get her into surgery now." "Lieutenant Commander, I understand you're upset, but Dr. Cole is the chief of surgery. His clinical decision is going to kill her." Marcus swung his legs over the side of the bed, ignoring the pain that shot through his side. "I know that woman. Her name is Dorothy Williams. Her son was Petty Officer First Class Michael Williams, Navy SEAL. He died in Afghanistan, saving my life." Patricia's face changed. "I didn't know." "Of course you didn't know, because nobody asked. Nobody looked at her and saw a gold star mother. They looked at her and saw a fat woman who wasn't worth their time." Marcus stood up. He was wearing a hospital gown. He had an IV in his arm and there was blood seeping through his bandage. He didn't care. "Get her into surgery," he said, "or I will carry her there myself." Dr. Harrison Cole was scrubbing out of a surgery when Patricia found him. "Harrison, we need to talk about the woman in the ER, Dorothy Williams." Cole didn't look up from the sink. "The obese one with the panic attack. What about her?" "She's having an MI. Her troponin levels are through the roof. She needs emergency intervention." "Then have Martinez do it. I'm not spending 3 hours in an OR with a patient whose body mass index makes every procedure twice as difficult." He dried his hands. "Besides, she'll just go back to eating garbage and be back here in 6 months. It's a waste of resources." "Harrison, there's a Navy SEAL in the ER threatening to file a formal complaint." Cole laughed. "A SEAL? What does a SEAL know about medicine?" "He knows the patient. Apparently her son saved his life in Afghanistan. Touching, still not my problem." "Harrison," Patricia's voice hardened, "if that woman dies, and this becomes public, a chief surgeon refusing to treat a patient because of her weight, while a decorated military officer watches, the PR nightmare alone will what, get me fired?" Cole smiled. "Patricia, I bring in $4 million a year in surgical revenue. I have a contract that makes me essentially untouchable. The board isn't going to side with a fat woman and a soldier with a hero complex over me." He pushed past her. "Now, if you'll excuse me, I have a golf game at 3. Dorothy Williams coded at 2:47 p.m. One moment she was slumped in her wheelchair, grey-faced and struggling to breathe. The next moment she was on the floor, not breathing at all. "Code blue! Code blue in the ER!" Nurses swarmed. Someone started chest compressions. Someone else grabbed a defibrillator. Marcus Reed, who had discharged himself from his bed against medical advice, was the first to reach her. "Her name is Dorothy," he told the nurse doing compressions. "She's 58. Her son was a Navy SEAL. She's not going to die in this hallway. Do you understand me?" "Sir, you need to step back." "I'll step back when she has a pulse." The defibrillator charged. Clear! Dorothy's body jolted. Nothing. Again. Clear! Another jolt. Still. Nothing. Come on, Dorothy. Marcus was kneeling beside her, holding her hand. Your son didn't save my life so you could die like this. Fight. Fight. A third shock, and then a blip on the monitor. Faint, irregular, but present. We've got a rhythm. Get her to the cath lab now. They wheeled her away, a team of nurses and a young resident running alongside the gurney. Marcus watched them go. Then he turned and walked toward the surgical wing. He had a doctor to find. Doctor. Harrison Cole was changing into his golf clothes when the door to the surgeon's locker room slammed open. Marcus Reed stood in the doorway. He was still wearing the hospital gown. He was still bleeding through his bandage, and his eyes were the eyes of a man who had killed before and was considering doing it again. You should be in bed, Cole said, annoyed but not concerned. This area is for staff only. Dorothy Williams is in emergency surgery right now. Marcus walked forward slowly. She coded in the ER. No pulse for almost 2 minutes. If she survives, and that's a big if, it'll be because nurses and residents did the job you refused to do. I made a clinical judgment. You made a judgment based on her appearance. Marcus was 5 feet away now. You looked at her and decided she wasn't worth saving, because she was overweight, because she didn't look like the kind of patient who would make you look good. Cole's face reddened. You don't know anything about medicine. You're a soldier. You break things. I fix them. I know that woman's son died saving my life. Marcus took another step. I know she buried a husband and a son and still got up every morning and taught children how to read. I know she spent the last 3 years drowning in grief, and the weight is a symptom of that grief. And instead of seeing a human being in pain, you saw a punchline. I saw a patient who was going to die anyway, Cole snapped. Her heart was failing. Her arteries were probably clogged with 30 years of... Marcus moved fast. One moment Cole was standing by his locker. The next moment he was pinned against the wall, Marcus's forearm across his throat. Her son's name was Michael, Marcus said, his voice barely above a whisper. He was 26 years old. He had a fiancée. They were going to get married when he got back. He died dragging me out of a kill zone because that's what SEALs do. We don't leave anyone behind. He pressed harder. Hio left his mother behind in a hallway having a heart attack because you didn't like how she looked. Cole's face was turning red. You're assaulting me. I'll have you arrested. Go ahead. Call the cops. File a report. Marcus smiled, a cold, thin smile. And then I'll call the Navy Times and CNN and every Gold Star family organization in the country. I'll tell them about the doctor who let a SEAL's mother die because he thought she was too fat to save. He released Cole, who slumped against the lockers, gasping. Here's what's going to happen, Marcus said. You're going to resign, quietly. You're going to leave this hospital and never practice medicine in Virginia again. And you're going to pray every single day that Dorothy Williams survives. Because if she doesn't... He leaned in close. I will make it my mission to destroy everything you've built. Your reputation, your career, your comfortable little life. I will burn it all down. And I will enjoy every second of it. Cole's face was a mask of fear and rage. You can't threaten me. I have lawyers. I have connections. You have nothing. Marcus turned and walked toward the door. You're a coward who let a woman die because you didn't want to work hard. I've killed men braver than you. He paused at the door. 24 hours, Dr. Cole. Resign, or I start making calls. He walked out. Dorothy Williams survived. The emergency surgery took 4 hours. A young cardiothoracic surgeon named Dr. Amelia Foster, who had heard what happened and volunteered to scrub in on her day off, found 3 blocked arteries and performed a triple bypass. When it was over, Dr. Foster found Marcus in the waiting room. She's stable, Foster said. It was close. Another 10 minutes without intervention and we would have lost her. But she'll live. She'll need rehab, physical therapy, lifestyle changes. But yes, Lieutenant Commander, she'll live. Marcus let out a breath he hadn't known he was holding. Thank you. Thank you. Foster sat down beside him. I heard what you did, confronting Cole, forcing the issue. She shook her head. I've watched him dismiss patients for years, the overweight ones, the poor ones, the ones who don't fit his idea of who deserves treatment. I never had the courage to say anything. You had the courage to save her life. Only because you gave me the chance. She looked at him. You know she's going to have questions when she wakes up, about what happened, about you. I know. What are you going to tell her? Marcus was quiet for a long moment. The truth, that her son saved my life, and that I owed her a debt I can never repay. Dr. Harrison Cole resigned the next morning. The official statement said he was pursuing other opportunities. The unofficial truth, which spread through the hospital like wildfire, was that he had been given a choice: resign or face a formal complaint from a decorated Navy SEAL, a review from the medical board, and a media firestorm that would make his name synonymous with discrimination. He chose to run. 3 weeks later, a former patient named Sandra Okonkwo came forward with her own story. Cole had refused to perform a hip replacement on her, citing her weight. She had lived with chronic pain for 2 years before finding another surgeon. Then another patient came forward, and another. By the end of the month, the Virginia Medical Board had opened a formal investigation. By the end of the year, Harrison Cole's medical license had been suspended pending review. He never practiced medicine again. Dorothy Williams woke up 3 days after her surgery. The first thing she saw was a man in a Navy dress uniform sitting beside her bed. Mrs. Williams, Marcus stood up. My name is Marcus Reed. I knew your son. Dorothy's eyes filled with tears. Michael? Yes, ma'am, we served together. Marcus pulled a chair closer. He was one of the best men I ever knew. And he saved my life. Over the next hour, Marcus told Dorothy everything. He told her about the ambush in Helmand Province, about the bullet that shattered his femur, about Michael dragging him 400 meters to safety while enemy fire exploded around them. He told her about the medevac and the hospital in Germany and the months of rehab that followed. And he told her about the ER, about Cole, about watching her code and refusing to let her die. You saved me, Dorothy said when he finished. I owed you. No. She reached out and took his hand. You didn't owe me anything. Michael made his own choice. That's who he was. He saved people. He couldn't help it. She smiled through her tears. You didn't save me because of Michael. You saved me because that's who you are. You're the same as him. Marcus didn't trust himself to speak. He would have liked you, Dorothy said. Michael, he would have said you were good people. That was his highest compliment. He was good people too, ma'am. I know, Dorothy squeezed his hand, and now I know that a part of him is still out there, still saving people, still refusing to leave anyone behind. Marcus sat with her until she fell asleep. Then he went back to his own room and cried for the first time in 3 years. The dedication ceremony was held on a Saturday in October. The Michael Williams Memorial Scholarship Fund would provide full-ride college scholarships to children of fallen service members. The first class of recipients, 12 students from military families across Virginia, sat in the front row, wearing their best clothes and trying not to cry. Dorothy Williams stood at the podium. She had lost 40 pounds since her surgery. Not because anyone told her to, but because she had decided to live, really live, for the first time since Michael's death. She walked every morning, she cooked real meals, she volunteered at the VA hospital, talking to veterans who needed someone to listen. She had also gained something she hadn't expected, a family. Marcus Reed sat in the second row, wearing his dress blues. Beside him sat his wife, Elena, and their 2 children, a boy named Michael, born 6 months ago, and a girl named Dorothy, who was 3. My son believed in service, Dorothy said, her voice steady. He believed that the strong protect the weak, that no one gets left behind, that every life matters, not because of what you look like or how much you weigh or how much money you have, but because you're a human being deserving of dignity. She paused, looking out at the crowd. A year ago I almost died. A doctor looked at me and decided I wasn't worth saving. He saw my body and made a judgment about my soul. Her voice hardened. He was wrong, and he was held accountable, because a man who had served with my son refused to accept that judgment. He fought for me the way my son had fought for him. She looked at Marcus. Lieutenant Commander Reed, please stand up. Marcus stood, uncomfortable with the attention. This man saved my life, Dorothy said. Not with surgery, not with medicine, with courage, with conviction, with the simple belief that every person deserves to be treated with dignity. She stepped away from the podium and walked toward him. Michael saved your life in Afghanistan, she said quietly, so only he could hear. And you saved mine in a hospital hallway. I'd say we're even. We're not even, Marcus said. We're family. Dorothy hugged him. The crowd applauded. And somewhere Marcus liked to think Michael Williams was smiling. The story of Dorothy Williams isn't just about a doctor who refused to treat her. It's about the invisible judgments we make every day and the people who refuse to accept them. Dr. Harrison Cole looked at Dorothy and saw a body. He saw weight. He saw a patient who would be difficult to treat and unlikely to change. He made a calculation. This life isn't worth my time. Marcus Reed looked at Dorothy and saw a mother. He saw a woman who had buried a husband and a son. He saw a teacher who had spent 32 years shaping young minds. He saw someone's everything. That's the difference between people who see bodies and people who see souls. Dorothy's weight didn't make her less worthy of treatment. Her appearance didn't determine her value. She was a human being in crisis, and she deserved care, not judgment. Every day, people like Dorothy are dismissed, in hospitals, in job interviews, in restaurants, on the street. They're told through words or through silence that they don't matter as much, that their bodies disqualify them from dignity. It's a lie. Your worth is not determined by your weight. Your value is not measured by your appearance. You are not the sum of other people's judgments, and somewhere out there someone sees you clearly, someone who will fight for you when you can't fight for yourself, someone who refuses to leave anyone behind. For Dorothy, that person was Marcus Reed. For you it might be a friend, a family member, a stranger who happens to be in the right place at the right time, or maybe, just maybe, it's you. Maybe you're the one who needs to stand up, to speak out, to refuse to accept the unacceptable. Because that's what heroes do, not the ones in movies or comic books, the real ones, the ones who see injustice and say, not on my watch. Be that hero, for someone, for yourself. If this story moved you, hit that like button. It helps us share these stories with people who need to hear them. And here's a question for the comments. Have you ever witnessed someone being dismissed or mistreated because of how they looked? And what did you do? Or what do you wish you had done? I read every single response. If you're not subscribed yet, now's the time. Hit that button and ring the bell. Next week, we're telling the story of a janitor who saved a hospital during a power outage and what his military records revealed. You don't want to miss it.